Good morning. Welcome to Georgetown University. I'm Anna Maria Maida. I'm the director of the Institute for the Study of International Migration here at Georgetown, and I'm a professor of economics. And I'm very happy to be co-sponsoring this event. So this is a very important event on the state of service programming for immigrant survivors of human trafficking. And it is co-sponsored by the U.S. Committee for Refugees and Immigrants, the University of South Carolina, Asylee Women Enterprise, and Ayuda. And I'm introducing Julie, who will be moderating the event. Thank you very much.
Good morning. I am Julie Beyer. I am the Senior Director at the U.S. Committee for Refugees and Immigrants. First, thank you to Georgetown University and the Institute for the Study of International Migration for hosting us today. We truly value this partnership and look forward to continuing our work together. The U.S. Committee for Refugees and Immigrants, USCRI, is a global nonprofit founded in 1911 to protect the rights and dignity of refugees and immigrants. USCRI provides direct services, policy and advocacy, and international programming to support people who are forced to flee. The organization works to advance humane, effective migration policies and help newcomers rebuild safe and self-sufficient lives. It's my pleasure to introduce Iskander Nagash, our President and CEO of the U.S. Committee for Refugees and Immigrants. Iskander brings over 40 years of leadership on behalf of refugees and immigrants. A widely respected leader in the field, Iskander has dedicated his career to advancing humane, effective migration policies, including for survivors of trafficking. So please join me in welcoming Iskander.
Good morning. Thank you, Julie, for this long introduction. As Julie mentioned, USCRI has been around since 1911. Actually, this is our anniversary, 115 years anniversary of advocating on behalf of immigration, migrant and refugees, and including survivors of torture. This gathering is special, given what has been going on, as some of you know, in the space that we work with refugees and migration issues. In fact, exactly a year ago, a lot of our engagement and work has changed. We stopped refugee resettlement. We laid off a lot of people. Refugees stopped coming for the U.S. In fact, prior to this January 20th, we did resettle USCRI in our network close to 6,800 refugees and some special immigrant visa holders. Since then, I think we resettled probably close to 400 people. This is just our 1-year anniversary. As some of you know, we have been doing refugee resettlement and asylum service for many, many years. In fact, since 1980, USCRI resettled close to 500,000 refugees around the country. So this is a special gathering given what's going on. There is a Chinese saying, I'm not sure it's a blessing or a curse. May you live in an interesting time. So we do actually live in a very interesting time. But just briefly to mention in terms of the work that we have done, since the Trafficking Assistance Program began in 2011, and since then we have actually USCRI, a very tiny organization, assisted 9,000 victims. That's really probably. I used to work with some of my colleagues here, at the HHS. This is a large number of people that we have assisted. I know, a lot of organizations have been part of our experience. Especially at this time, given the international discussion and discourse in terms of refugees and migration in general, I think a victim of human trafficking has been a little bit forgotten. And we hope as we continue to do that, even though we started direct service in 2011, we have been an advocate for a humane treatment of victims of human trafficking. As you probably know, it is becoming a global issue. It's not just in the here in the U.S., but it has been spreading, including with the refugee and migration perspective. So the funding cuts of refugee program, the funding of other NGOs, including USCRI funding, the State Department funding, the trafficking victims are really going through a very difficult time. Number one, not getting access. Number two, they're not getting the protection they need also. So we at the USCRI, we continue to push for a humane treatment of not just only victims of human trafficking, but all victims, regardless of their nationality, where they came from. We partner with this report is really the first report. Hopefully the final report will be published in 2017. But we feel that there is lack of data. I think data is also help us in terms of doing our advocacy work. So I think this report, this engagement is we think that it's going to change the discussion a little bit better. Hopefully we'll get the 2027 report soon, and then you have a chance to look into it. But at the same time, I wanted to just share with you, recently I came from a refugee camp called Kakuma. It's in Kenya. There are about 300,000 refugees. They've been there since 1992, I put almost 30 years. So the trafficking issue is not just only here at the cities and restaurants, it is also in refugee camp. We witness a lot of kidnapping, trafficking, even in the refugee camps. So the suffering of those people, especially those who have been in this protracted situation, kind of refugee work happening for over 30 years, 35 years, is also another cause. There's a widespread hunger, suicide, but at the same time, kidnapping and trafficking of young girls, especially. So again, we when we discuss this issue in terms of data, in terms of advocacy work, just keep in mind, there are about 110 million refugees and IDPs. I mean, if you could put them in one location, that would be probably one of the largest countries. Within that structure, within this warehousing structure, you will have a lot of victims of trafficking, for sex trafficking, labor trafficking, and other issues. So as part of our discussion, always we wanted to bring the human suffering aspect of it. So I encourage you to do your own advocacy work, but at the same time, try to work with us, and we're open, and then we will continue to do the advocacy work. So again, thank you very much for coming in this very cold weather to join us. So again, thank you very much and appreciate it. Yeah.
Thank you, Iskender. It is now my pleasure to introduce Ben Roth. Ben is the Associate Dean for Curriculum and Associate Professor at the University of South Carolina's College of Social Work. Ben is the lead author of the TVAP and Aspire Evaluation Preliminary Report, which you all received a copy of today, and there should be a copy of available for those of you who are attending online as well. The preliminary report provides an initial insight based on the first year of data collection with case managers, supervisor, and USCRI staff. So please join me in welcoming Ben Roth.
Thanks, Julie, and it's a pleasure to be here. Thanks especially to BART, USCRI. So I'm going to briefly talk through some highlights of the report, the preliminary report that we published. It's in the service of setting up a panel that's to follow. And what I want to though say by way of kind of stage setting, thank you so much, Julie, is what is not the focus of our preliminary report. We are going to drill down mostly on what does it look like to actually do this work? What are some of the challenges and constraints that organizations that are implementing TVAP and Aspire are encountering on the ground? Missing from this conversation today are really the voices of survivors themselves. And I want to acknowledge that and really appreciate Iskinder's point that that we can't separate or decouple the real need for all of us as advocates wherever we're working to humanize the reality of and the atrocities of human trafficking wherever it happens. Even while today we are going to primarily focus on what it's like to implement a program like TVAP and Aspire. So foreign nationals of trafficking, victims of trafficking, these are individuals who face a particular set of challenges. As immigrants, they have the challenge of not only interfacing with mainstream institutions where maybe culturally and linguistically there isn't alignment with their own country of origin. Many have fled situations in their countries of origin where they fundamentally distrust authorities and governments for very obvious reasons. The case management program of TVAP and Aspire aims to connect them in part to the benefits and services that may be available to them where they live. But this work is made even more challenging given the backgrounds that and vulnerabilities that many survivors of trafficking experience day to day. On top of that, of course, many have a precarious immigrant status. Those who are en route to a T visa are on a long extended timeline to adjust their status. And meanwhile, as was pointed out, we have the ever dynamic and unsettling reality of enforcement patterns in the United States. So what's TVAP and Aspire? Well, put simply, it provides time-limited case management. So it is that basic. It does so much more, however, but it is time-limited, and it is essentially, at its core, an effort to assign a trauma-informed case manager to an individual who's been identified as a survivor, who then connects them to local services, legal representation, mental health care, and other kinds of basic needs that others kind of basic need providers that may be available in their locale who can help. So this is the organizations who are implementing this are scattered around the country. They're located in places where survivors live. The USCRI, therefore, has to network with local implementing partners across the country so that they can provide case management, time-limited case management services to someone who lives in rural Georgia or the urban center of Seattle, wherever they might live. So as you can imagine, then the contours of this local environment vary dramatically. So we'll get into just briefly about why that matters for how case management implementation looks from one place to the next. For this preliminary evaluation, we spent about a year, beginning in July 2024 through July 2025, doing multiple interviews with about 50 case managers and administrators around the country. And a lot of this work, to be honest with you, is just introducing ourselves. We're a research team. So on my team is John Dorian White, also on faculty at USC, Jung-Suk Kim, who is on faculty at USF. And we have several doctoral students who have assisted us in this project. And understandably, this is the first time, as I understand, that TVAP and Aspire have been independently evaluated. So some of this was just like introducing ourselves to some of these small organizations in South Dakota to say, here's who we are, here's what we're aiming to do, will you join us? So these are organizations that are already strapped for time with limited resources and under our current moment, under a lot of strain. So to have someone knock on their door and say, mind if we look under the hood to better understand what it looks like for you to implement this was a big ask. And so I really want to recognize the fact that in that year of talking to case managers, and they were willingly opened their doors and allowed us to better understand what it's like to implement. We're not done. As Iskinder mentioned, this is going to go on through September 2027 when we will submit a final report. And the USCRI team, understandably, what they really want to know is what happens to survivors once they've finished with this program? What comes next? This is a bit of a black box, and we are hoping to better understand, drawing on the voices of survivors who complete TVAP and Aspire, what happens once you finish with the program? Because that's a big part of measuring what implementation looks like. Let me tell you a little bit about client demographics. Dramatic pause while we wait for the clicker to engage. Okay, and it sort of maybe comes off and on, it's okay. So apologize, I'm going to go off slide if you don't mind. Client demographics, one story to tell about the clients that we serve, or that are served by TVAP and Aspire, is that many come from Central America and Mexico. But critically, not all of them do. In fact, in the case of TVAP, over 1/3 come from countries of origin outside of Central America and Mexico. This is less the case for Aspire. Aspire recipients or survivors are youth under the age of 18, TVAP are adults. But one important story to understand about the implementing of TVAP and Aspire is that clients come from very different contexts. And even, of course, within a country like Guatemala, you have folks from the highlands of Guatemala where they may not even speak Spanish because they speak an indigenous language. In other words, there's incredible linguistic and cultural flexibility that a given program needs to have in order to functionally work effectively with survivors. Another important client demographic is that roughly 2/3 of TVAP clients during this period of fiscal year 24 through 25 were survivors of labor trafficking. So so it's not only sex trafficking, and some are survivors of both. But what this means, if you put yourselves in the shoes of a case manager, that on top of the national origin, cultural, and linguistic variability that is present on your caseload, you're also tasked with figuring out how to, in a trauma-informed way, engage clients who may come from trafficking backgrounds that differ dramatically, one client from the next. So the kind of plasticity that this requires from case managers is remarkable. Then there's the fact that, as I mentioned earlier, survivor clients are located across the country. And some of the concentrated areas may not be surprising to you, given that these are large immigrant destinations to begin with. California, for example, and Texas, both having an outsized portion of TVAP and Aspire residents, survivors. But it's important to remember that many other states where they're settling don't necessarily have a large immigrant serving infrastructure, organizations that are accustomed to working with survivors who may not speak English, for example. So what this means across urban and rural contexts, across different state boundaries, where in each state there may be a more accommodating set of policies that would complement TVAP and Aspire supports, because there are state-level anti-trafficking laws that direct resources to organizations doing this work. You have enormous variability. You have case managers who are serving clients across multiple county contexts and at times across multiple states. So there are service deserts that certain case managers are responsible to try to navigate. So while all case managers who are implementing TVAP and Aspire have the same mission and objective given them by USCRI, they have to adapt it in ways that that are incredibly challenging, depending on where the survivors live. I was just talking last week, actually, with a provider in Texas, and he said, let me put it this way, that this organization implements all kinds of programming for different immigrants. They also have a TVAP and Aspire contract. And he said, what's different about TVAP and Aspire is that there's no typical case, that they're unable to formalize for, say, a new case manager to be like, okay, here's what you do in this situation, here's what you do in that one. There is no playbook. Yes, USCRI provides an incredibly helpful manual that says, here's how it should look. But when it comes to the point of implementation, it requires an enormous amount of ingenuity and legwork on behalf of implementers. On top of that, for case managers, there's a tension between the constraints of time and the realities of funding. So these are mission-driven organizations, and the people that we have talked to come to this work not because they're motivated by financial resources, the salary that they may earn. These are people who are coming at this because they are truly driven by a human rights orientation to advocating for survivors. But they have to provide the case management services during a limited time frame, because this is time-limited case management services, that doesn't always map onto the wait time for survivors who are holding out for a T visa. That is the device created in 2000 by Congress to allow about 5,000 people a year to adjust their status. And I'm not going to get into T visa conversations today, but just the fact that there is a misalignment between how long they can serve clients and how long actually clients need those services. Case managers also talk about this administrative burden. They described extensive time spent on invoicing, tracking individual budgets, and documenting work in small increments. They need to do this. And in fact, the importance of doing it is critical because it allows USCRI to better understand just how intense the work is. The problem, however, is when you're a case manager working with a highly vulnerable population, who is a population that is suspicious, perhaps, of mainstream institutions. Survivors who are afraid even to leave their own house because of ramped up ICE activity in their neighborhoods. Building rapport with your clients is that much more critical, but you also have the burden of documenting everything you do. So the twin objectives here of showing USCRI, here's what implementation looks like, while attending to the rapport building requirements of your clientele, puts case managers in a tough spot. And there's repeatedly we hear across the country how benefit access is harder than it should be. Congress provided through the Trafficking Victims Assistance through TVAP provides a way for T visa eligible individuals to have access to public benefits, select public benefits for a certain amount of time. But just because you are able to provide documentation showing that you are eligible for those documents doesn't mean that when you go to the federal benefits office to request access to the benefit for which you're eligible according to congressional authority, that the person attending you is going to recognize the piece of information that you provide showing that you're eligible. Instead, what we hear from case managers is that they are constantly educated frontline service workers in these institutions, being like, no, this person's eligible. This is what this document means. 6 months later, there's someone new in that office that they have to re-educate over and over again. And then coming back to this idea of trust, that effective case management that's trauma-informed hinges on this idea that you have to establish rapport. It's in the USCRI's manual. And case managers know that this is critical, but it takes time. And when you have, as mentioned before, clients who are afraid to go to the benefits office because they saw on social media that there's an ICE checkpoint that is happening right down the street. This can inhibit people's willingness to even leave the house to access the case management services that you're aiming to provide. So in summary, case managers have to hold a couple different truths. First of all, the fact that TVAP and Aspire are really important for this, for survivors. This is doing important work, and it is critical for this vulnerable gap until they're able to adjust their status and set about the task of rebuilding lives. And implementing TVAP and Aspire, it's not easy, and it's not enough. That's not USCRI's fault. It's part of a reflection of our current moment and the willingness of Congress to fund what they are willing to fund. So hopefully this sets the stage for our panel discussion. And so I pass the reins back to Julia. Transition to that next step.
Thank you, Ben. I'd like to go ahead and invite our panel members up. Our panel members for today's event include Ben Roth, as well as Bart Bachman. Bart is USCRI's Associate Director of our Anti-Trafficking Services. In his role, he manages our TVAP and Aspire programs, including its National Anti-Trafficking Framework. We also have Lori Hidalgo from Asylee Women's Enterprise. Lori is their Trafficking Survivor Advocacy Program Director, and the Asylee Women Enterprise is a service provider and partner of USCRI anti-trafficking programs. And Paula Fitzgerald. Paula is the Executive Director of Ayuda. Paula was kind enough to join us this morning as her Legal Director of Programs Victoria was unable to attend. Paula began her work with Ayuda as an immigration staff attorney and then managing attorney, focusing on humanitarian relief, including Violence Against Women's Act self-petitions, U visas, T visas, and special immigrant and juvenile status petitions. And so with that, I'd like to turn the first question to Bart about your biggest takeaway from the preliminary report.
Thanks, Julie. And thanks everyone for being here. I think my first takeaway was just a huge amount of gratitude to Ben and his team for finally getting everything that I feel like everyone on my team has heard in frustrated calls from case managers, calls from Lori, calls from Paula, calls from a lot of people who I see here talking about kind of the successes, but also the challenges of the program. And I think right after that amount of gratitude, I had this really sinking feeling knowing that everything was getting worse. Because as Ben said, I think the data collection kind of went through last July 2025. And some of the big pieces were waiting times for benefits, which then was about to go into total chaos when trafficking survivors were no longer eligible for SNAP beginning in October of this past year, 2025. The chaos around removing their eligibility for SNAP and the upcoming eligibility for Medicaid. We saw just made all those waiting times and confusion even worse. People being denied for SNAP, which they needed, people being denied for other benefits that they were supposed to still be eligible for, even though they were supposed to be eligible for it. There was just the confusion because everything was changing so quickly. And the other piece, of course, that I feel like one thing that really came through in the report, again, was that mismatch of the funding and the expectations and how the funding wasn't going to be enough to kind of provide those comprehensive services that we wish we could provide this population. And when I got the report, I knew that we were looking at a budget shortfall for the year and that we were probably going to have to slash even further the amount that we're able to give the case managers and agencies who do this really important work. So I'm really, again, don't lose my gratitude. I'm very happy that it's kind of in there in the report for everyone to see. But I do think it came in a moment where it's just, unfortunately, things are on the downhill rather than being in a place where we can build on these findings on improvement.
Thank you, Bart. For Lori, your program works directly with survivors of trafficking in the Baltimore area. What have you been hearing from the survivors that your agency serves?
First of all, I'll start by saying, really repeating what you've already heard, how critical these services are. Immigrant trafficking survivors often fall into a group that is not in a recognized group, like refugees, asylees, which means without some kind of structure, they get lost in the system. They don't have a place to land where they can receive the support that we try to give. As you heard in Ben's report, it takes a lot of flexibility of case managers, flexibility of an organization to really create wraparound services around what is required within TVAP and Aspire. Benefits are important. Sometimes it's not an option. Mental health is important. Sometimes it's not an option or it's not wanted. And so, again, as Ben said, it is really a person-centered program, right? It's every single individual that walks through the door is different. What we are seeing, obviously, is an increased amount of fear, to walk through the door, an increased amount of fear accessing services in the community that are still available to these individuals, lack of resources, individuals who maybe used to work are now either not eligible to work, they're not getting work authorization, or they are scared to work, which increases the financial need. We see fear around immigration status, T visas, juvenile, the individuals, SIJF, I'm not supposed to be an acronyms, the special immigrant juvenile status, different visas that our clients have often had access to, possibly will no longer. And even the fear of going through that process can be overwhelming. Fears of going into schools, our case managers enroll in school. Oftentimes our young people are here to have access to schooling. That's no longer happening. I could go on and on about what we're hearing and seeing, but also one of the things we're witnessing is because there's so much complex trauma that our clients have experienced, often in home countries, their journey to the United States and here, the trafficking experience itself and other traumas that they've experienced in their lifetime, identifying risk can be really complicated. And so we're seeing especially our young people take risks that we want to work on them, but that they should not be taking because it puts them at higher risk of being detained and or deported. So there's a lot of education that has to go on around what did we do yesterday that maybe we're not going to do today. So that I think sums it up.
Thank you. I appreciate that. For Paula, as leader of an agency that provides both legal services and case management services, what barriers have you observed for survivors of trafficking?
Yeah, I would echo everything I think Lori said. On the legal side, one requirement to apply for the T visa is reporting to law enforcement with certain exceptions. And the fear that we're seeing is definitely getting in the way of people's comfort referring their trafficking to law enforcement. So what we're doing at Ayuda with our legal clients is we're seeing if more can fit within the exceptions, either the minor exception or the trauma exception. And so we're having some of our clients meet with mental health providers, seeing if there's diagnosis that could be used for the trauma exception, seeing if we can file more cases without forcing clients to have to go through the reporting piece, if that's really going to be what gets in the way of their applying in general. We are seeing with the huge backlogs now for T visas, that they might not find safety under that program for a very long time. At the end of last fiscal year, USCIS had approximately 33,000 applications pending, and they're adjudicating about 2,000 to 3,000 per year. So that means that unless the adjudications increase, the survivors could be waiting for up to 11 years for a decision on their case. So because of that, and because things are looking so bad right now, we're also being transparent with clients about these realities and seeking alternative forms of relief. So we might apply for a T visa, but also asylum or a U visa or SIJS or whatever other form of relief. And we might do several cases, which is a lot more work on our end, but it provides a lot more opportunities for them. Also, in 2025, greater scrutiny was placed on what we call early adjustment certification letters. So basically, after a trafficking survivor receives a T visa, they can apply then for a green card or residency, either after 3 years or if they obtain an early adjustment letter from US DOJ saying the investigation is complete. What we're seeing on the ground is that USCIS is denying cases that don't have that language exactly stated as so. It might say the case is no longer open, no longer active, or have similar language to that, and they're denying that under that. These adjudications are taking several years as well. So at the same time that we are fighting their denial and those decisions, we're preparing to refile under the 3-year rule. And so it's requiring some creative lawyering, but a lot more applications and work and touch points than in the past. So that's some of what we're seeing on the ground. It's it's definitely, as Julie shared, I've been doing this work for a long time, and it's definitely gone downhill in terms of, from the perspective of trafficking survivor and T visa, the support and safety they can gain.
Thank you so much. So a question to each of you. How have you seen agencies respond to these barriers?
We have had to be incredibly innovative around, we've always had to be innovative. TVEP and Aspire, as I said, is so important in creating the structure. But because we are committed to this person-centered, trauma-informed case management, we've had to be innovative in making sure that it can last longer than the amount of time we're allowed, that there's financial support when needed beyond what we can use, what we can get with TVEP or Aspire. And so now when we're in an agency where everything is changing for asylees, as well as for refugees, trafficking survivors, it's really about being creative with how we respond to emergencies, how we use our finances. And we have found that we've tried to streamline some processes. So we have created a rapid response program where we have all the critical information for all of our clients in one space, where if we find that they or a family member has been detained, we can contact appropriate people. We may be assisting with temporary guardianship for children. We are consistently accompanying clients almost everywhere, whether it's biometrics testing, whether it's a doctor's appointment, an emergency room visit, a legal consultation, obviously benefits. We are accompanying any ICE check-ins. We always try to have someone there. Now, in that, we have to be innovative there too. We have a lot of staff who are not US born. And obviously those individuals we will not have go to an ICE check-in. We have had experience where our case managers have been forced to prove their citizenship as they are accompanying a client. So for their safety, we have to be creative on how we move staff around and jump in on different places. With our programming, for our case managers, it's really now about creating this relationship, this safe place. We want people, if they were in, we just got a call yesterday from a client who worked with us 3 years ago and received a T visa. So we're thinking, okay, we're pretty good to go. He can adjust at some point. Well, it's gotten more complicated. And he reached out to us. So now we have to we want to continue to work with him because he's in a completely different world than he was 3 years ago. And so it's just about the flexibility. It's really about the safe space. We provide a lot of direct assistance as needed. The costs have gone up in terms of legal fees, applying for work authorization. We assist with that. We've had a lot of people whose spouse or roommate have been detained, so they've lost someone who's providing financial support in the home. We help with grocery deliveries. People are afraid to leave, so we have people drive the food to them. And I could go on and on with that, but it's really just, thank goodness, the flexibility of our staff, our agency, seeking funds in alternative, places, looking at, community foundations and funds to support. And thank goodness in Baltimore we have that. But it is just being able to pivot at a moment's notice and be there for the clients, as stressful as it is for us. That's obviously incredibly more stressful and emotionally debilitating for the individuals we work with.
Yeah, I shared some of the adjustments we've made to some of the challenges I mentioned before. We also have started to increase our advocacy efforts. So we participated in to get to 5,000 campaign encouraging CIS to process the full amount of 5,000. T visas every year. Obviously, during this time, I'm not sure that this will happen, but I think a longer term campaign around that and having the advocacy effort aligned with our direct services work. What Lori said, creating a safe space. Ayuda's been around for more than 50 years. So community members have experience with Ayuda, and there's trust that has been built up over the years. So we're just being honest with our clients and being transparent. And unfortunately, sometimes the news, and a lot of times the news now is not very good news. But we're trying to help our clients do risk assessments to make the best decisions for their situation, not trying to cherry coat or sugarcoat the situation at hand. And then whatever our clients decide to do, we try to help them find the best results based on that, and just kind of walk with them through that process, whatever it looks like for them. It's a super challenging time. I have a lot of people asking me to try to make people feel better, and that's a really hard challenge right now, because unfortunately the facts and the realities we're sharing with our clients is so difficult. But we're there with them. We're there to provide kind of acceptance, a warm welcome, walk with them, and I'm hopeful that even through these challenging times, that's very meaningful to the community we serve.
And I do want to add a couple of things, and this is true for all of the agencies. First of all, it's really building these partnerships, and which we've always had in this world. We have very strong partnerships with agencies all around the area, the DMV area, and in other states as well. But we have to solidify those partnerships. We really have to build them because no one agency at this point can do it all. But it's also really about the access. We have to remove barriers to gaining access. We want people to walk through that door. And so we have to help even more than in the past, providing lifts, providing the financial assistance I spoke about. We have, again, as Ben mentioned, we see clients all over. So we have one client who lives about an hour to an hour and a half away from the city and is a minor and has a learner's permit and receives treatment for HIV in Baltimore. So has to commute to his doctor's appointments. Obviously, he cannot miss the doctor's appointment, and had been using a learner's permit to drive to his appointments. Obviously, that's incredibly high risk. So really saying, okay, we're going to help you here. This is too dangerous right now, especially, so we'll provide lifts. So it's really lowering the access, having someone watch children when someone comes for a legal consultation. Whatever those barriers may be, we try to remove them so that people can access the necessary service.
Yeah, I think, again, I'm so grateful for Ayuda and Asylee Women Enterprise. The first thing that I think this sums up the headspace we're all in is how do some agencies respond to barriers? And some have had to stop these services. Luckily, these agencies have been able to continue, but some have looked and said, we don't have the funding, we don't have the support. The amount of time and effort and case management hours it takes to support this population isn't feasible anymore. And I feel like when we have those calls, the next thing is always like, how can we help? What can we do to make sure that they still get help? And that's where we at USCRI have stepped in whenever possible. I feel like everyone is trying to be, even though I can't do this anymore, I don't want to just leave the survivors stranded. We really want to keep helping. And that's, again, all of the partnerships. I feel like calling up every agency possible to try to figure out where we can refer to, trying to get creative, what other programs can help serve these survivors. And, I think for me, I just keep coming back to like all of that trust and how to respond to that. I think unfortunately right now, we live in a world where like we're seeing like there are trafficking victims being deported while their traffickers get to stay here or remain at large. And I think if I see that and we see that, the trafficking survivors see that and the traffickers see that. And that just sets up everyone for a loss and, kind of puts the system at a real deficit to start. So it's, again, just responding to each fear. I saw ice in my neighborhood, in my apartment building. Can I move somewhere new? I saw ice around this area. Like, can we go to a different grocery store that makes it feel a little bit better? I think really just listening to each survivor's fears and, again, trying to work with them on each individual situation to try to help them through that.
And knowing that these new barriers the old ones and the new ones, it increases the risk for trafficking. So ultimately, we're going to see more labor trafficking, more sex trafficking, both as a result.
I just wanted to piggyback on what Bart said. I think those stories are really powerful. And I think they're in the advocacy side of things, the dialogue around safety and the safety of our communities, and really taking back that term safety when MPD, for example, we're in DC, cooperates with ICE. Really, I think those of us who work in this field, there's an argument, a strong argument that the community is less safe because this is benefiting the traffickers, the abusers, the exploiters, and that victims now are afraid to come forward to report crime, trafficking, and others. And so I think that we should be shouting this from the rooftops. When you make an entire population of immigrants afraid to report their crime, what does that do to safety in your community? Is that what you want for your community? Even if you don't care about this population and what's happening, you care about your own safety, perhaps. And so I think trying to reclaim that narrative around safety and those in the victims field, there's a lot on the advocacy side there.
Did you?
I feel like maybe we should move on to the next question.
Yeah, no, of course. So what recommendations would you have to improve, and I know we touched on it a little bit, but to improve the national support system for all survivors nationally?
This is a hard one because we could spend hours going on with recommendations prior to 1 year ago. But I mean, for me, it's really, I cannot stress enough how crucial TVEP and Aspire are to the immigrant trafficking survivors, many of whom are minors with complex trauma histories. And as I said before, it really is the only thing that provides a structure to providing comprehensive, trauma-informed, and appropriate services to a group of people that are so incredibly diverse. You can't just jump in and say, okay, we're going to do this. At our agency, we used to have, it was mostly asylum seekers, and case managers would also work with trafficking survivors until about 5 years ago, we separated it out. And it was so important because the legal pathways are different. It's just a different set of circumstances. And so the biggest recommendation for me is finding a way to keep these programs going. I get angry, I get frustrated, but really having it even at its most basic level, providing that structure and support is really crucial.
I don't know. I think it's a great question because here's the conundrum, in my opinion, that first of all, organizations like Ayuda have this understanding about how to reframe, how to reorient a public that may otherwise not have this as a visible issue that's worthwhile their attention. And I think that is really powerful. Many other organizations that we're talking to in rural Colorado, they're talking about how the one legal aid entity that they rely on to help even provide direct legal assistance for their clients, that they are closing their doors. That they don't know where to go even to get that critical thing. And this is what providers across the country say is providing legal relief for their clients to make sure that because 97% of T-visa success cases have legal representation. You need to have someone helping to represent you. The issue is that if you want to raise awareness and try to reframe this at a national level, it draws attention to a program that has somehow survived a colleague. And that's the rub. At once, how do we make sure that this doesn't call attention to people who might decide it's not worthwhile to keep, while also bringing awareness about the great needs that survivors experience and that TVEP and Aspire can, in a small way, help attend to. That's the challenge, I think.
I'm just curious, and I don't necessarily know the answer here, but maybe you all have some thoughts. Trafficking traditionally has been supported on a bipartisan basis, or not trafficking, but trafficking prevention programs, trafficking victim services. I mean, do you all see that we still have allies in this work that are willing, on both sides of the spectrum, that are willing to fight here? Or I don't know, do we have people like this?
I think for me, looking at the kind of national response, I think I see two things. And first, as kind of Ben was mentioning before, I think one of the big issues is just that we actually only see trafficking, or we've put in the investment to create services to identify it. Like looking at the data, we see most of trafficking survivors in California, Texas, and I think DC was one of them. And I was like, I feel like DC is probably only up there. I think there is a lot of trafficking here, but we have two great providers and others in the DMV area that's identifying those survivors. Like, are there people actually identifying survivors on the farms in rural Iowa or in the Dakotas or somewhere else? Or is there just something that's we're not seeing at all that's not being identified? So I feel like the national piece is really missing. And then, to Paula's point, I think what I see now is that somehow trafficking is like bigger than ever. I feel like you see it colloquially in so many different spaces, but then the response only ever wants to focus on one specific piece. And everyone is against trafficking, but everyone thinks that they have the magic bullet for trafficking, and then that's going to cure it, whether or not that's more online awareness prevention, whether or not that's increased law enforcement, whether or not that's even social services can exist in a vacuum. And I think that what we're seeing is that, if you only focus on one piece, then the rest is going to crumble. And that is going to be, you have to raise all of the anti-trafficking response together, or it's not going to work. I think, again, as Paula was saying, and then we're discussing, like, when law enforcement increases and that fear of law enforcement increases, that makes all survivors less likely to want to cooperate with law enforcement or immigration enforcement or HSI or those other agencies. We saw agents being removed from trafficking towards immigration enforcement, and how that reinforces those same kind of narratives for survivors, makes them more fearful. So I think there does really need to be, I don't know how to bridge those divisions and how to bridge those different perspectives on trafficking, but we really need to look at the whole system and figure out how can we support all these different parts, make sure that any trafficking isn't working. So I think preparing for this, looking at the data, I think that the conservative estimate is that trafficking is a $150 billion industry worldwide. ILO says over $230 billion. And I feel like we are not putting anywhere near that. A drop in the bucket against that is what we're currently putting against the trafficking fight, in the fight against trafficking. So if this is something that we care about, we have to decide that and really put the resources and coordination and that kind of visionary work into creating that response.
Because at this point, it does feel that we're really working in this kind of very small, creating allies in the police department, a detective who may be able to kind of get around some, if a client is afraid to report, kind of get around that and come in, who speaks their language and can take a report and make it feel safer. You're constantly creating allies in a really small area because that kind of overarching support does not exist.
And I think to add on to that, I think that we see in really isolated pockets that partnership working really well. Like we see in some cases working with law enforcement, and they've asked our case managers to travel with them to provide that emotional support for a testimony, for a deposition, for something else like that. There are little pockets in cities where, we see the HSI agent and FBI and the local police department and the social service providers really all working together to respond to this. And then they agree that it takes everyone to do this work. But then unfortunately, those are still way too isolated. We really haven't been able to scale that and replicate it in other places.
Yeah, I think, Lori, the point about local advocacy, focusing in on localities or on friendly jurisdictions that are more likely to implement local policies in favor of trafficking victims, and working with those that want to show some level of resistance to the policies that we're seeing. And so, for example, at Ayuda, we have been focusing in on DC, for example, cooperation with MPD. And I can't say we've made a huge waves, but I do think we have made some, presented some accountability around that, and had the access to have these conversations with the powers in the city. And so I think there is a lot to be said, even though it's a really tough time to make systems change. Nationally, locally, there are opportunities right now. There are jurisdictions that really want to resist a lot of these policies and show that they stand with immigrants or they stand with victims of human trafficking or victims of crime. And we can give them an opportunity to put that into action in some way, even if it's not as big as we would like at this point.
I mean, we just had the Baltimore sheriff announce that ICE will not be permitted in the courthouses. They will not be allowed. Now, we know as service providers that, okay, well, they'll be around in a parking lot, but just the speaking out, you know, it makes front page. He's speaking out, he's taking a stand. It is meaningful, and it is meaningful for victims and survivors.
So just tying that all together, because Paula in her initial remarks had mentioned walking with survivors of trafficking, and a story you had highlighted where sometimes you have to be more mindful of how case managers are participating in the process. And now seeing where there are some successes in some areas, is there a way to kind of consolidate what that could look like? Because we do have our in-person audience, we do have a national audience online joining us as well, and maybe a suggestion of Bart, sort of what you're seeing as that good collaboration that then maybe other organizations can then try to work with in their own jurisdictions.
Sorry. I mean, I think the word of the day, like that Ben talks about, is just that trust and building that trust and trying to, even when it's really hard, trying to get, there are the task forces that, try to get people together. But I think sometimes we'll see that there's a response to like an emergency case, an extraction, trying to get a survivor who wants to leave a trafficking situation. And it's the first time everyone in the room is meeting each other. And like, if you don't have that trust and those relationships beforehand, then you can imagine how that's going to go when you're in a high stress situation. And like, honestly, sometimes even we see that everyone knows each other, the attorneys, the law enforcement, the case managers, they know each other. And then as soon as that trafficking extraction situation comes up, they still go back to their corners. And, law enforcement doesn't want the attorneys to have access before a certain time. Attorneys are fighting law enforcement for access it to be in the initial interviews. The case managers feel like they're too late. I feel like one of those stories that always kind of stuck with me from when I was a very young person in this program was a case manager was helping respond to an active trafficking situation. And the law enforcement was like, well, I don't know why they're so upset. Like, we ordered pizza for them. And it was like, well, maybe they don't want pizza. Maybe did you ask them what they wanted? Is that something that they enjoy? Did you ask them what they wanted? Did you ask them maybe they prefer something else? And again, just simple things like asking, what survivors would like. Do they want a drink of water? Do they feel like they're just being rushed from one person to another? Taking the time and having that kind of building that trust is what's most important. And I feel like you only would be aware of those things if you're looking at it from each angle from the very beginning, if you have everyone in the room and that you're able to kind of make those plans. So, I think as mentioned, just even sometimes if it just feels like you're kind of hitting up against a hard wall over and over, just keeping on trying to have those conversations going and building those trust.
Yeah, I would say at Ayuda, some of that is also built because we don't only have an anti-trafficking program, we also have a very strong domestic violence and sexual assault program, which tend to run really concurrently a lot. And so we do develop relationships with law enforcement. I'd say we come into contact with them more on the domestic violence side than on the human trafficking side. But because of that, we do have certain law enforcement officers that we trust more than others that we would be more likely to want to go to. So we are somewhat strategic when we do help someone make a report to who we're reporting, to someone that we have found to be a trusted resource versus shooting into thin air, whoever may be out there. And so I think there's a direct complement with domestic violence services in building that trust, building that confidence there with whatever police department you're looking at as you work with survivors, and just being able to tell someone, I know this person, I've helped X number of clients make reports here, and they've gone, well, this is our experience. Still, it's up to you to make your decision and make your risk analysis, but you can incorporate this into it, this relationship that we've developed.
I mean, again, we do really cover such a large geographic area, each program. Even, there are going to be areas where we have more relationships than others. I mean, we're in Baltimore City, we have clients on the Eastern Shore, but it's just because every situation is different. Case managers themselves, it's not just, the executive director or the director of the program making these relationships. Everyone is involved in, task force meetings. Everyone's involved in, meeting with lawyers or with police if necessary. And so the information that each, and the allies and the relationships that each case manager creates is really unique and important. So we may not be going out to the Eastern Shore. We do have to do some remote work, really finding ways to build rapport with a client that way, and also build relationships in the community for the next time we have a client who needs to be referred. And then that usually builds. We're in Baltimore, but we're on task forces for labor trafficking in Prince George's County. On these task forces, you have politicians, you have school, administrators, you have case managers, you have police, you have state's attorneys. I mean, you have a really diverse group. And so a lot of the relationship building and then working together happens in those meetings, but then after with a relationship that you've created, ultimately to help our clients.
We call victims of trafficking survivors for a reason. It gives them agency that they have and deserve. But these organizations that are serving them, they're also in a state of survival. They're in survivor mode. And we've asked them to provide case management services, but we are also asking them to be educators, ambassadors, advocates for larger systemic change. That is a lot, people. So I don't know what your final take home is from this conversation, but at very least appreciating that these organizations are living in this increasingly strenuous buffer zone between a hostile environment and a highly vulnerable group that for multiple intersecting reasons is maybe uniquely vulnerable. Immigration status, trauma history, linguistic and cultural misalignment with the mainstream entities that are trying to or not absorb them. So it's their stories who matter, but at least for today, it's also attention to this really difficult buffer zone in which these organizations are operating. And I think just having people recognize that and appreciate it in this, even if it's just in this room, that doesn't solve anything. But I think it might help with a kind of a circle the wagons sort of a story. Like, we need to get through this. We need to survive this moment as an organization so that we can continue to do the important work today, tomorrow, and moving forward.
And keep in mind, we're working with individuals between the ages of 7 and 70. I mean, really, it's an incredibly vulnerable population, as you said, for many different reasons, and even things as simple as an individual deciding to self-deport becomes incredibly complicated. We have a 17-year-old who wants to self-deport because she came here for her education, but she's afraid of being detained and deported. And in home country, after 18, you can't enroll in school if you haven't completed it. So she wants to get home as soon as possible, so that she can complete school. But then you need to get notarized paperwork from home country. You have to get notarized paperwork from here. She's a minor. Can she travel alone? Well, she's an unaccompanied minor, unaccompanied child. So everything, every little thing is like, an incredibly large set of hurdles.
Yeah, I think that I would add on that too, I think one thing that I want to convey to people is just the sense of urgency, the kind of constant sense of urgency that the agencies and the case managers are kind of working with. I don't have the statistics. I'm not a professor like some other ones here, but I think we see that those most likely to suffer abuse or be re-victimized or re-trafficked are those who have suffered abuse or victimized by trafficking already. So often the case managers really are in a position where, they see someone who is very vulnerable to being re-trafficked, who is vulnerable to new forms of abuse, like domestic abuse, intimate partner violence, and kind of feeling like they're one of the few people who is having to do all these roles, as Ben said, who's, supposed to help the survivor on their path towards, independence and stability, who's also trying to figure out the right support network for the survivor to keep them from regressing backwards into another trafficking or another abusive situation. I feel like that really does have a big toll. And again, I think we just aren't giving that the support or care or kind of acknowledgement that work really needs or requires on almost any scale, local, national, state, whatever it might be.
Thank you. Shifting a little bit, because the report also discusses the lack of resources for clients and long wait times. Can you describe how eligibility requirements are tied to immigration status, affect survivors' access to housing, healthcare, and other benefits? I know, Bart, you started to touch on that a little bit earlier.
Eligibility requirements for
tied to immigration status.
Eligibility requirements for TVEP and Aspire.
For benefits.
For benefits, sorry.
Ooh.
Yeah. I mean, I think again, the big thing we see is Ben had like 17 to 27 months for a T visa application. Right now is looking more like up to 11 years with the current processing times. And then that doesn't even include all the time it takes to create the T visa application, to actually do those initial interviews, to talk with people. We see that someone who's left a trafficking situation enters TVAP, they may not even have their T visa application out the door in the 6 months or 12 months that they're in the program, because it takes so long to make sure they're getting that right. And again, that kind of just limbo period where they're trying to access work authorization, trying to access benefits that can help them, just leaves them in a void.
Well, and it's important to know, so for minors, once they are eligible for Aspire, they have something that Ben spoke of, which is a certification letter, eligibility letter. They are immediately eligible for benefits. And 1 year ago, the process would be you go and get a non-work social security number, and then you apply for benefits. It wasn't easy then. It was all hard. It takes a long time. Sometimes you can't get it. Sometimes it's you fail, and finally get it. But in October, they lost access to SNAP benefits, so it's only medical assistance. However, what we're seeing is that even getting the non-work social security number, they don't have even a space for trafficking survivors, so they check them off as DACA, not eligible. So eligibility 1 year ago looks really different than eligibility now. For adults, you're not eligible for any public benefits until after you receive the T visa. So that's 17 to 20 months or even longer, because we can enroll clients to receive the case management services prior to having a lawyer. So the time it takes to find a lawyer, the time it takes to submit the application, you're going on years before they actually have access to any benefits. So the vast majority of our clients do not have access to public benefits, even though they are eligible for TVAP and Aspire and the intensive case management services.
The one thing I would kind of add on there, to correct Lori a little bit, but I know why she said it, is that the one other access for adults to public benefits is meant to be continued presence, which is a law enforcement-led process, a law enforcement-led immigration status. And why we always forget it is that we never see it issued.
Maybe like 2 times in the last 6 years.
I think I would have the vantage point, from seeing it nationally, and I think we see like less than 10 or 20, issued, and that is meant to be the tool, and that is again we have this increase in law enforcement. There's meant to be this coordination between law enforcement and social services to create this response. And then all these places where there's meant to be overlap, it just falls apart. And then that leads to less trust. That leads to less trust between the survivors, the service providers, the attorneys, the law enforcement, everyone. And those cracks really show.
And continued presence really should be offered to any individual who is cooperating with law enforcement. That's the idea. And that happens rarely. Not the cooperation, the actual continued presence.
We're going to transition to some questions from the audience. So if anybody in the room has any questions, you're more than welcome to stand up. Everybody should be able to hear you online as well. And I know we're starting to get some questions in from online. But was there any questions from in the room that anybody? Well, I'll let you think about it. But one of the questions we have online is, what are the sectors you're seeing labor trafficking? And they gave a couple of examples of construction, meatpacking plants, etc. I'm not sure if anybody can speak to where you're seeing labor trafficking in terms of industry.
Sure. I mean, domestic and often an overlap with intimate partner violence there. So it can be domestic servitude. It could also be considered like sex trafficking as well. Poultry plants, restaurants, construction.
We see some kids by their ORR sponsor, Office of Refugee Resettlement sponsor, and the same what you're saying, people in domestic violence situations who are trafficked by their abuser is a big one as well. The DC area is kind of unique, and there's not as many plans and things like that. But
I mean, the miners are working. A lot of that is in fencing companies. So I guess that's under construction. I mean, restaurants are a big one.
landscaping.
Landscaping. Thank you. Yeah, that's a huge one. Roofing. Any industry, really, it's a risk. But I mean, where we see high immigrant communities, a high number of immigrant workers, especially if they don't have work authorization, which we're also seeing more of. Before, where you could get it, you might not be able to afford to even apply for it anymore. It puts it at higher risk. So all of what we've said, and if you have any more to throw out, I'm sure.
Well, I really appreciate that question, because I think all of us want to know, like, what's shifting and where should we look? Mm-hmm. But I think one of the cautions that I have as just a kind of a researcher coming up alongside this is it's like being in a pitch dark room with a flashlight, and you're going to see it wherever you're looking for it. Wow. And talking with some of the survivors, so we've done some early interviews. A couple of things stand out that I just think are worth mentioning here. One is that part of the reason why we don't see it unless we're looking for it is because some people who are survivors of it don't see it themselves. Mm-hmm. They don't recognize themselves as having been trafficked. It's a weird term. Even that word, trafficked, suggests movement across something, but that's not necessarily what is required to satisfy the condition for being trafficked. Another reason is because some people are ashamed. I'm thinking of some of the survivors we talked to are men who have been labor trafficked, maybe in landscaping. And it's like, I feel like I've been hoodwinked, like I was tricked. And that feels like an assault to my own ability to read a situation, right? I mean, it's just so striking how the various, how diverse the reasons might be why someone who is currently a survivor of traffic may not raise their hand and be like me.
I mean, that's children who have been sex trafficked in group homes. Children who have been trafficked on their journey here. At home, in home country as well. Oftentimes we'll have clients who have more than one trafficking history. Childcare, we often see it. But yes, I mean, it sometimes it's not identified, and sometimes it is extremely uncomfortable, especially individuals who come, they think maybe they're working at a restaurant and it very kind of slightly turns into sex work, forced sex work. So there are a lot of reasons why we may not identify it, but every industry you see it, the ones we've stated are the ones we are most often coming into contact with.
Yeah, I would add, I feel like trafficking can happen anywhere, but we really do see it in a lot of like the low wage contract work that employs, large immigrant populations. And I think getting to what Ben said it, and what we've all said is like, I feel like we really just don't even have a grasp on it yet. Like I feel, I think that, there's definitely, a kind of needed like a way that data and funding and like services all kind of go together, kind of like rise together. But I think we're just so behind the ball right now on this, just across the board, and that we just don't have a handle on it. I feel like there are so many nuances. People still see trafficking as either like the Taken movie or nothing else. And there's so many different like layers of labor exploitation, wage theft, involuntary sex, rising to labor trafficking, rising to sex trafficking. And there is a lot of gray area in there that people just aren't educated on, either to identify it or to acknowledge in themselves. And I feel like, that's where all of these misleading narratives and kind of, we need to figure out a way to get out that kind of real message of what this actually looks like.
And it also happens within families. I mean, this is not all about, being trafficked in home country on a journey or right when they get here. Sometimes people are coming to live with a parent who has said, we're going to make sure you can go to college. And then it turns out that there's a situation of domestic servitude. I mean, there are so many situations, but oftentimes, they're lured by false promises. And really, we just know, at least for adults, it's most often, there's some kind of force or fraud or coercion involved, but that can be across the board anywhere.
Thank you. Go ahead.
Do I have to stand up? I'm wondering if you all can speak to a little bit about vicarious trauma of staff and whether the report touches on that a bit, because we've focused on the survivors of trafficking, which is really important to do, and also building trust. But if you have high turnover, jaded personality, a hardness of your case managers or service providers, how does that impact the trust and the work that we're able to do?
I mean, I can speak to our agency, and very lucky to work in an environment that is really as focused on the people working with our clients as the clients themselves. And you have to be. And also many of our staff have had, related experiences, whether it's trauma or immigration, or, it can be a lot. So, our lead case manager is here, so if you want to speak with her afterwards, she's sitting right there. But it's really important to just really maintain open communication, build in some fun. We laugh a lot, try to. This is, in my entire career, the single most difficult time I've had working, existing, surviving, and in the work we're trying to get done. And I am not usually working directly with clients anymore. For the caseworkers, it's really being also innovative and creative in how they work together, how they support each other, being able to identify when a situation might be getting to be too much. Is there another, working really in partnership so that it's not one case manager with one individual, and if that person isn't able to be there today, then there's a complete loss. So working as a team, taking breaks, like sometimes longer breaks, than normal, and just being in touch. It's hard right now. I think it's hard, and it's watching people that you care about and you want to support, not really being able to give that you can give the safe space in the moment, but I think Ben said it before, you can't provide, or no, I think what we all said it, you can't really, there's no incredible solution at the end of it. So always. So you really celebrate small successes. Like yesterday, one of our case managers took a client who has just an incredible history of trauma for biometrics testing. And they got there and he didn't have a state ID. Clients can't get state IDs mostly. So he had a CASA ID, which is what he uses, and they weren't going to allow him to do the biometrics testing. So thank goodness the case manager, it's not even it's the case manager, it's another case manager in our program who jumped in, and he waited and pushed and spent hours, and they finally accepted the CASA ID. I mean, that was like really celebrated. It was a huge success. So our whole team celebrated it together, but it's hard right now.
Yeah, I'd say it starts with just recognizing that this work is extraordinarily hard. It's very, it has lasting effect on the people that are providing the services, and recognizing that at the leadership level so that all of the policies of the organization are taken into account. It's not just like how many numbers can we get and driving people to do more. I think there really has to be a balanced approach, a lot of flexibility. We at Ayuda, we have pretty generous leave policy. We have wellness days. So we're not necessarily providing all of the support in terms of, okay, and we do this too, but time for people to do what recharges them, what allows them to kind of recover, refuel from some of this. And I think a lot of it is also listening to the staff and what they need, because I think for everyone, wellness looks very different. So I think there's just flexibility running through the policies through and through. I think with trauma-based providers, that's crucial for people to say, we have our social services director here, Anna, and she's been able to retain our social services staff for many, many years. And I think some of that is applying this balanced approach, is providing the flexibility. We had a case manager, I remember, had a very difficult situation. She wanted the day off the day after, right? And so it's simple things like, you need this, encouraging that. We got you, you're backed up, take the time, and I think all of our colleagues kind of the same. We're a team and we're going to take care of each other. And we're also encouraging people to take care of themselves. And then I know I've mentioned advocacy a lot, but there has been interest, and I think it recharges some of our staff to have some involvement on the advocacy side, because they're so angry about a lot of what they're seeing, and allowing them to participate a bit on the advocacy side to engage on the systematic issues, I think has helped people feel a little bit more empowered and balanced. And so, again, not what you might think of when you think of wellness or whatever it might be, but we actually had staff ask for that as a form of wellness.
We also have in our agency, and I think it's crucial for a lot of people who work there, access to therapy.
Yeah.
That is a benefit covered by the agency. So, and there's been increased flexibility in that if an employee does need more than maybe what was allotted in the beginning.
One quick comment. Yeah, we are definitely seeing it in the report. Mm-hmm. And in fact, one of our doc students, Maria Velasquez, down at University of South Florida, is writing a dissertation on that topic. And I would just say on top of all this, it's the fact that especially for some of these big organizations that have historically relied on funding to support refugee resettlement, these are case managers who are watching the systematic dismantling of the organization that is paying for them to do the work. So it is vicarious trauma, but that is coming at them from multiple directions.
And agencies that are maintaining, staying afloat or watching their partner agencies.
That's right.
Mm-hmm.
Yes.
I had a question, because there's multiple agencies that are in the stage of rebuilding, or as you said, staying afloat or surviving. And I'm just wondering, I'm seeing maybe a restructuring that's happening. And do you have a recommendation for just networks or supports for, departments that might have to refigure out how they're going to work with limited resources? Like you had mentioned about the rapid response line, how other agencies can mimic or create within their local communities. And I'm speaking from like the DMV area, but
yeah. I mean, I would love to talk with you afterwards. I think it really depends on what we have. Our rapid response is not a line, it's a team. So it's how we, as a very small agency, can respond quickly and appropriately for any of our clients or their family members who are detained. We had a lot of plans 1 year ago, 2 years ago that have had to be, restructured. We've spoken about the shortened amount of time in TVAP and Aspire. So it's been really finding creative ways to create a place where we don't have to just rely on that 6 to 12 months, or allow clients to come back when they've completed TVAP and Aspire. But all of this really depends on funding. So sometimes it really has to do with fundraising. We've done a lot. We're doing a lot of work around fundraising, different kinds of grant writing, different grants that we're applying for. And that is kind of the base. To do all this creative, innovative work, you need money.
Was part of your question about restructuring the organization or mergers, acquisitions, or more about restructuring of the program that your organization's doing?
probably like the restructuring of like the programs themselves, like in terms of services.
Okay. Because I know, a lot of the programs that are very small and then are reducing funding, there's a lot of support out there for organizations that are potentially looking to merge with others or restructure in some way. And I think it's really important to think realistically about that, and there's a lot of resources out there. I know in the DMV, I've been in a number of meetings about that, to make sure that these services don't disappear, to make sure that if that's what it looks like, it's better to merge with another organization and retain some of that expertise and knowledge than to lose the whole. And so I know that's not what anyone wants, but I think it's like reevaluating the whole and how can we keep what we have to the best of our ability. And there are resources, I can name several in the DC area around that. There are a lot of things to think about, and I can say for our agency, we're constantly thinking of how to restructure, but you also don't know what's coming, so you can't just jump into it. You can't say, okay, this is where we're going to move. So it's really maintaining the capacity to pivot at any given moment, which also is a lot of stress on staff. But it's really, right now, it's just imperative that you have, especially if it's a smaller program, the ability and the desire to, because you have to want to be able to do it. It's hard. So, but it really is just absolute flexibility. I'd be happy to speak with you, and our executive director is here as well. And she's been really supportive and focused on being able to find alternative funding opportunities, any kind of fundraising possible, any kind of, including staff in those fundraising ventures, but also really keeping people informed regularly, weekly meetings. We have bi-weekly staff meetings. We have community meetings where our clients can get information on Know Your Rights, but also kind of grieve together, ask questions, talk, really kind of allowing it to be an environment where we can pivot at any time and we're kind of all in it together.
Thank you. We are at time, so I appreciate everybody coming today. I do want to thank Ben Roth and our panel members for this important discussion. And we'd like to take a moment to thank all of our service provider partners, case managers, in the crucial role that they play in providing these TVAP and Aspire services nationwide. And, through its programs and its nationwide network, USCRI assists refugees and immigrants who experience human trafficking both before, during, or after their migration into the United States. And these programs and its services are critical to providing rights-respecting services to survivors of trafficking, helping them reestablish their sense of safety, dignity, confidence, and independence. And as you heard today, there are real challenges faced with implementing these programs, but being able to offer services that can include housing, immigration legal aid, employment training, and assistance with basic needs plays a large role in helping clients develop independence and work towards overcoming the traumas of trafficking. And as we look forward to the final report next year, we encourage everyone to join USCRI in its commitment by getting involved to ensure these continued resources can still be available to assist survivors. We need to continue with advocacy and collaboration and donations. Thank you so much. We appreciate your time.